global nursing shortage is dire. Today, many are in a death grip due to a severe lack of nurses.
Globally, we have a crisis that is a shortage in healthcare professionals. Globally, we're looking at a deficit of 4.3 million healthcare professionals. So if you're looking at all the initiatives out there that are so worthy in improving maternal health, decreasing child mortality rates, stemming the advance of HIV, TB, malaria, and other diseases, the missing link in all of this is that there's no healthcare workforce to support these efforts.
For those living in developing countries, imagining a world without nurses takes no imagination at all. There is an alarming lack of adequate health care in places like sub-Saharan Africa, where nurses play a particularly critical role.
They're the ones at the bedside. They're the ones who see emerging diseases, and they're the ones who understand what families need and patients need, and they're the ones providing the care.
Even though the World Health Organization in 2006 acknowledged the tremendous shortage of qualified nurses and other healthcare workers around the world, to date, the global response has not addressed or come up with solutions to address this problem. And I think the Gretta Foundation steps forward at a time in our history that has a very concrete solution that to my knowledge, is not out there anywhere else that says
we want to increase the number of nurses, and that's the essence of our mission. And how we do that is through in-country nursing scholarships. And in-country meaning that these are nursing students entering into their country's educational system. We're using existing infrastructure, and by doing so, we're supporting existing infrastructure. They're gaining an education that's relevant to their culture and to health dynamics around them, and it's more cost effective. The Gretta Foundation provides full nursing scholarships. We're providing room and board, tuition, medical allowance so students can get medical attention when needed. They'll get uniforms and shoes, clinical supplies, and also lastly a living allowance.
Because the scholarship itself, it has made me now somebody, although I haven't yet achieved what I need, but I'm looking forward to getting it.
The scholarship has really made a difference in my life. That I now have hope, and I am able to settle down in class and read confidently, and I know that there won't be any interruptions.
we have the potential, in a sense, of not only increasing simply the numbers of workers, which is a tremendous need in country, but supporting the professional sustainability of nursing in the country at the same time.
We just need to help what is already there.
The Gretta Foundation provides a solution to a well-identified, documented problem globally. It addresses women's development issues. It addresses healthcare globally. It's a sustainable local solution that we have not seen before.
Nurses are instruments of change who empower their communities by caring for the ill and provide the only real hope for disease prevention and cure.
By supporting a nurse scholar, 1, 2, 3, 4 or more, we are taking an impoverished and vulnerable person out of poverty, providing the tools to enter into an indispensable profession, nursing. And if we look at the impact that that nurse will have in her career, it's simply incalculable, that impact on humanity.
I know it's a challenging career, but it's all about sacrifice and your heart and what you have for the people. Helping someone when that person is sick, it's something great.
We are also looking forward to touch other people around us and make a difference around the people we live with.
Thank you.
Thank you so much for availing this. I'm so grateful.